I'm Dr. Jennifer Sweeton, and in college, I worked the overnight shift at a crisis hotline where I worked with hundreds of people in their darkest moments. Later, as a neuroscientist at Stanford and clinical psychologist specializing in PTSD, I discovered the science behind what I had witnessed, that our brains possess an extraordinary ability to change, not just as a result of trauma, but also during healing. And my own experience with PTSD as a high school student after losing a friend to suicide taught me that these changes are profoundly physical as well as psychological. The challenge we face isn't just about managing emotions, it's about understanding how our brains physically change in response to stress and trauma. When emotional pain hits, our brains process it through the same networks as physical pain. And this isn't just true for PTSD, it happens with everyday stress and reactivity. Most people don't realize they're dealing with actual physical changes in their brain, so they try to think their way out of emotional reactions. But the solution lies in working with our brain's natural mechanisms to heal ourselves. And there's two approaches we can take. The first is a bottom up approach that starts in the body and moves upward to the brain. Using deep breathing, progressive muscle relaxation, and other tools, we can directly calm our brain's emotional centers. The second are top down approaches. They start in our mind and move down to the rest of the body. And this is where we learn to relate differently to our thoughts rather than fighting them. So, whether you're dealing with trauma or everyday stress, understanding these neural pathways gives us practical tools anyone can use. Neuroscience tells us that our brains are changing all the time. We can learn how to guide that change.